Learning Community Webinar. I'm Ron Spingarn, Project Director of the Pathways Project at Transform Health, which manages the Pathways support team on behalf of the City of Sacramento for the project. Thank you all for joining us today. Today's presentation is being recorded. The recording and slides will be available in the next day or so, and we'll share them with those who were invited today as soon as they are available. I will be introducing today's topic, briefly reviewing our meeting agenda and a few ground rules, and then introducing our speaker, John Tan. If you have any technical problems, please feel free to use the chat box feature and send us a message. Today's topic is the basics of Medicare, SSI or Supplemental Security Income eligibility, and Medi-Cal, and how these relate to each other. Next slide, please. Oh, great. Sorry, back one. Great. We are focusing on SSI, Medicare Basics, and Medi-Cal so that the City of Sacramento can help build community and capacity for the community through the Pathways to Health and Home provider community in order to support our clients' long-term housing stability and wellness needs. Pathways continues to serve people living with disabilities and an aging population that needs assistance managing what can be challenging application and enrollment processes so that they can receive a wide range of benefits they are eligible for, including health coverage. Given the complexities of the Medicare program and its intersections with SSI and Medi-Cal, Pathways service partners play a critical role in ensuring that our program's enrollees do not suffer from a lapse in benefits, which can lead to a gap in getting the services they need. As I mentioned, SSI is a critically important program for eligible persons with lower incomes to access certain benefits and health coverage options, especially persons experiencing homelessness, older adults, and persons with disabilities. SSI can help Pathways clients access a source of rental income to support their housing needs, particularly persons who don't meet eligibility criteria for or can't access the permanent supportive housing program. The SSI application process can be time-consuming and confusing, especially for persons experiencing homelessness. Many studies suggest that homeless disability claimants are denied benefits at significantly higher rates than other claimants, often due to a failure to navigate the cumbersome application process, not because of a medical impairment. This training will walk you through SSI eligibility in California, how it relates to Medi-Cal and Medicare enrollment, and how these three programs come together. At the end of today's presentation, we will review some case examples to illustrate the SSI application process. Next slide. We hope that as a result of today's webinar, many of you will be able to navigate these systems and help your clients access benefits for programs they are eligible for. Today, we will review federal and state income support programs, including health coverage, and their relationship with Medicaid, which we call Medi-Cal in California. This will include Social Security Administration programs like SSI, general assistance programs like some California-specific income support programs, and an overview of Medicare. Next slide. We ask that each attendee use their own computer, if possible, during today's presentation. This will help us count everyone who answers our polling questions during the webinar and allow us to reply to all questions asked during the presentation in the chat box feature, if needed after the webinar ends, directly to the person who asked the question. We really want to hear from you, so if you are sharing a computer now and send us a question in the chat box during the presentation today, please provide your email address to us so we can get back to you if needed with an answer. Also, all of your questions will help us identify topics for our future learning communities. Please do not share any personally identifiable information, PII, or personal health information, PHI, about Pathways clients in the chat box. Lastly, please note this event is being recorded so you can share it with others afterwards. It will be available shortly after today's webinar via this YouTube link, and this information will be sent out to each of you who have provided your email address to us after the webinar. Next slide. Our speaker today works for an organization you may know about, and if you don't, you should definitely check them out. It's called HICAP, which stands for the Health Insurance Counseling and Advocacy Program. HICAP is funded by federal and state dollars and provides free, confidential, one-on-one counseling, education, and assistance to individuals and their families about Medicare, long-term care insurance, and other health insurance-related issues and planning for long-term care needs. It also provides legal assistance or legal referrals to help people dealing with Medicare or long-term care insurance-related issues. Their programs serve Sacramento County and 8 other counties, and their counselors are trained to help Medicare beneficiaries understand the complex insurance options available in our region. In case you want more information, they also conduct community presentations and outreach to beneficiaries and community organizations. So again, if you have not yet used their services or referred clients to them, please do check them out. Next slide. So now I'm excited to introduce our speaker today, John Tan. John is from the Greater Sacramento Region HICAP program, where he is a program manager and managing attorney with Legal Services of Northern California, or LSNC. John has been with LSNC for 9 years and began working as a staff attorney for the Senior Legal Hotline, working on grandparents' rights and mediation. More recently, he worked with LSNC's Health Rights Unit, working with healthcare consumers in 32 counties on a wide range of consumer issues. Before he went to law school, John earned a master's in public health degree from UCLA in community health sciences and a Master of Arts degree in Asian American Studies. And might I add, John is a super busy guy. We are excited to have him here today. And I have heard from others who have seen him present that he is super knowledgeable about the topics he'll be covering for us today. So John, thank you for being with us, and I will turn the reins and the slides over to you.
Thank you very much. Let me see if I can make this work. All right, so thank you all for having me here today. I want to start with the caveat that I know of these programs. I may be comfortable with them, but I'm not necessarily an expert in all of them. But I do work with people who work with a lot of these programs much more carefully than I do. So what I'm hoping to do for you all today is just technical stuff. To just provide you some information on what you about some of those topics that Ron just introduced, and also start you thinking about what resources are already out there, what you may be able to do for your clients, and places to go for assistance regarding some of these issues. So to provide more information about our organization, Legal Services of Northern California, of which our HICAP program is part of Legal Services. Legal Services is the civil legal aid organization for 23 Northern California counties, including Sacramento. And then our HICAP service, our HICAP program, much like Ron stated, serves 9 Sacramento region counties. including Sacramento. And our mission is to provide quality legal services that empower the poor to identify and defeat the causes and effects of poverty. So what we do when we work with anyone, whether it is a client or with a community organization or as we advocate for change, is to look for the root causes of problems that our clients are seeing and work to eliminate those causes. And as Ron mentioned, I worked in the health rights portion of our program, and that unit focused on empowering consumers to understand and exercise their healthcare rights. So the goal for this presentation is to increase awareness of the available programs that would help with supplementing income and healthcare to folks that you may be encountering as you do your work. To familiarize you all with basic program eligibility criteria, identify some of the pitfalls that we've experienced when helping folks with disability, SSI, Medicare, and Medi-Cal, so that when you work with folks who use these programs, what they may encounter as problems and where to go in order to troubleshoot those programs. I'll also pepper in resources as far as if you needed to do additional reading or wanted like a publication. There are a lot of them that are available online, and I've tried to link as many of those as possible throughout these slides. So let's start with the first poll. So what are you hoping to learn most from this presentation? Are you looking for general information about the programs, income and health assistance for older and disabled adults for the Social Security Act, some resources for income assistance such as SSI, to understand how Medicare enrollment works in general, resources for dual eligibles, aka Medi-Medis, or Medicare and Medi-Cal enrolled beneficiaries, or all of the above? Let's go on for a couple more seconds. All right. So ending poll, looks like the majority of folks want to understand all of the above. Great. So, I mean, hopefully you'll get a sense of some of these. Get something out of this. Again, this is sort of an introduction. So if you do end up having more questions, then that's great, because you're hoping to apply some of this information to situations you see in your work. And maybe some of the stuff that we talk about today and some of the resources that I introduce you to can lead to more of those questions being answered, and also to where you would need to find out whether or not to send someone over to another organization to get assistance on more advanced subjects. All right, so what are we going to cover? So there are a lot of different public benefits, but I think in consulting with the folks over here in setting this up, we sort of focus on income and healthcare. So we're going to look at Social Security programs. We're going to look at Supplemental Security Income, or SSI, and then the county's General Assistance, or GA program. So some basics about all three of those income support programs. And then we'll look at healthcare. So specifically, we'll look at Medicare and at Medi-Cal, which is California's Medicaid program. All right, so when I talk about Social Security, there are two specific Social Security programs that come up. There is retirement, which is, there's basically the work portion of it, the ones where you've paid into the system. So that's disability or retirement, Title II of the Social Security Act, where you have to have had worked enough quarters and paid into the system. And then there's Supplemental Security Income, SSI, which is sort of the welfare portion of it, the needs-based portion of it. There are eligibility criteria. There are asset tests and income tests for that program. It is a means-tested program. For both of these programs, there is some basic level of eligibility you need to understand, and it either involves age or a severe disability expected to last at least 12 months. So people can age into these programs, or they can become disabled and get some sort of income support based on their disability. And to apply for either of these programs, you can go to your local office or call your local office, since most of them are not open for business. But a lot more convenient for folks, or at least for folks who have the ability to do so. A lot of the application paperwork is online. So that's also where you can track applications. So if you are assisting a person with an application, that's where you can print out the application form and mail it or fax it to an office. You can find your local office through the website's office locator feature. And you can find a lot of the publications that I'm referring to during this presentation over on Social Security's website. Okay, so talking about retirement. So traditionally, when we think of Social Security, we think of, I'm old enough to retire, I've paid into Social Security, now I can draw down on that. So in order to be eligible for the old age portion of it, this program is known by the abbreviations OASDI, and I wouldn't be able to tell you every single part of that acronym, but the OA is old age. So that's what we traditionally think of as Social Security. I get old enough to become eligible for Social Security. And you're eligible to receive a monthly amount that's based on your work history. So you need to have 40 credits. That's equivalent to 10 years of work that you've paid into. Regardless of how much you've paid into, you just need to have credits for paying into it. You can also claim work history through your current or former spouse. Now, there are rules about how long you need to have been married, when you need to have been married, if you're divorced from that person, sort of other things like, did you remarry? Those are complications, but know that folks can, if they have a spouse or a former spouse who may have had enough work history based on that relationship, they can claim a Social Security retirement benefit. Now, these benefits are going to be calculated based on the earnings and when you start receiving it. So you may have heard people say that they're taking early retirement, because you can start taking Social Security retirement at the age of 62. That's different from Medicare. So Medicare uses similar rules with work history, but Medicare, for aging into Medicare, it does not start until the age of 65. So that may be a very different time than when someone starts taking their retirement. If you start taking your retirements your Social Security retirement benefits at the age of 62, they use a formula to reduce the benefits that you've earned, because the expectation is that you're taking the benefit for a longer period of time. And then once you reach full retirement age, then you're entitled to your full, basically what you're supposed to be getting. And then your full retirement age depends on when you were born. So by statute, they sort of increased the retirement age. And if you listen to congressional legislation proposals, there's often talk about increasing the full retirement age. This is how they do it. They do it through legislation. So if you were born after the year of 1960, your full retirement age is at the age of 67. So that's when you would be entitled to the full amount that you should be getting based on your work history. Now, if you were born before 1954, the full retirement age is 66. And if you are born sometime in between, they've sort of staggered at 2 months increments. when your full retirement age would be so that you wouldn't experience this reduction in benefits. Now, you could delay your benefits if you're still working, or if you're fortunate enough, probably none of our clients, but if you're fortunate enough to have other forms of income to support you, even if you weren't working, you could delay your benefits in order to get more. And you can do that through the age of 70. After a certain point, you have to start taking benefits. But that's sort of the math that goes into what that monthly Social Security award looks like. Now, that's retirement. Recall that you could also get this Social Security program based on your work history if you're disabled. And this is someone, again, you've paid into the Social Security system, you've worked the 40 work quarters unless you became disabled before you turned 24. Then there's some sort of, again, so there's this staggered math that is used to figure out how many work units you actually need to, or someone that you can claim from you would need to be able to use. So these benefits are based on the earnings that you earned during those quarters, however many quarters are relevant to your disability. And with Social Security disability, you automatically get Medicare after 25 months of entitlement. And note that that's of an entitlement. So some people, it takes a long time for them to get their Social Security disability. So their Medicare may start almost immediately after they get their first check because they were determined eligible in the past. Generally, you cannot get the Social Security disability income if you're 62 or older. And a lot of folks, their SSDI, their Social Security disability income, converts to early retirement or converts to full retirement if they hit that relevant age. And that becomes a problem for certain Medi-Cal programs. If they had, for instance, the Working Disabled program, that is not something we're discussing today. But note that that conversion of income sometimes causes problems when you have to have disability income for a certain program. So the term's disability, but what does that mean? So you have to be disabled to get Social Security disability, and also for SSI, which we will talk about later. But the key is medical evidence. Does the medical evidence line up to this definition, which is that this person has a disabling condition that causes a person to be unable to work for at least 12 months or result in death? So the key is ability to work. And so there is this 5-step process for SSDI applications where they will ask certain threshold questions, and they will, at certain points, you're either in or out, or you go on to the next step. So the first question is, are you working? They will look at your income to see if you're making enough to be considered gainfully employed. And so there is a monetary threshold that will be used to look at your income for any given month. And if you make over that threshold, which for 2020 is $1,260 a month, you are able to work. And this is earned income. It's not like you're getting some other benefit that wasn't work-based. They call this substantial gainful activity, or SGA. I might lapse in between all those two terms throughout this presentation, but basically they're just looking at your monthly income to see if you are making too much. And then they'll look at your medical condition and ask if your medical condition is severe. Remember that this is about conditions, certain physical or mental health conditions that affect your ability to work. Now, if they find that you have a severe medical condition, again, the medical evidence is key to determine the severity of the condition. They'll ask whether the medical condition meets or equals a listing. So there are a lot of regulations involved in Social Security and Social Security disability. They've set out a whole list of things that are available online of what medical conditions automatically are disabilities. So certain listings, certain mental health listings, for instance, are under, I think, category 14 or something like that. And they will go through different organ systems and different conditions and list out what would meet a listing. So what medical evidence would support the fact that you are disabled because of X? And just because you don't meet the explicit listings in that list doesn't mean you're not severely medically, that your disability is not severe. You can make the analogy that based on the medical record, you equal a listing similar. So if the listing is wobbly enough to be inclusive to include your disability or your medical evidence, and you can point to A, B, and C equaling what this one does, then that's the same as if you met the listing. It's just not written out explicitly. Now, at that point, if you meet or equal a listing, the answer is yes, you are disabled, and they move on to determining your eligibility as far as when your disability started and how much money you can expect to receive. But if they don't find that you meet or equal a listing at step 3, they will go down to the next 2 steps, which are all about what kind of work did you do and what kind of work could you do. So this is where they bring in vocational experts. There's a whole book about like all the jobs available in the economy and what types of tasks you can do. So they will look at your work history because you have to have had some work history to get SSDI. And they're going to see, are you able to do the kind of work that you did before? And again, having the medical support to say that job required me to lift 20 pounds, to do all this stuff. And if the doctor or doctors can state that, no, this person cannot do the former job, then Social Security will look at, can you do any job in the economy? Anything, not just what you are doing, but anything based on what skill set you have. And I've seen some really ridiculous things. I don't know how many people work as nut sorters, but that is something that they talk about. What is it? Hand cart operators. There are things that I'm like, yes, that job exists somewhere, but it's not here in our neck of the woods. But they will point to that to see if you can do any work. And again, that's where having good medical evidence is key. And that's where I see a lot of problems with some of the folks that we've worked with, especially folks who don't have steady health care, they don't have providers. There's not enough of that medical history. So you have to supplement it sometimes with some of the social history. So if you know that they've worked with some social workers or other providers of social services who can comment about their abilities or lack thereof, that's how you would supplement places where the medical evidence isn't as strong. And then once someone gets on SSDI, it's not like they get it forever. There are things that can happen that can trigger termination or discontinuance of benefits. So your benefits are supposed to continue as long as a person is considered disabled, meets that 5-step test. But every SSDI and SSI disability person is supposed to be evaluated in a certain amount of time, whether it's 5 years or 7 years or 3 years. There is an expectation of these continuing disability reviews. And they'll send paperwork to check on the status of the person, get some medical records, and do that review again to see if there's been any medical improvements. And if there's medical improvement, Social Security will tend to try to terminate a person from the SSDI program because now they can go ahead and work. For SSDI, remember that one of the threshold questions, the first threshold question, was about income, was about substantial gainful activity. So for someone who is on SSDI and then starts to make more money, there are incentives for them to go back to work so they can do some level of work over a period of time without their benefits ending. So this is a trial, called a trial work period, and they can continue on benefits for 9 months within basically a 5-year window if they start making substantial gainful activity. And it doesn't have to be 9 consecutive or continuous months. It can be, it just is 9 months during a rolling window. So if someone on SSDI gets SGA in 3 months and then spends the next 5 years without making money, then that 3 months doesn't count anymore because you've already rolled 60 months out. But that's important because if someone picks up some work and then has worked for more than 9 months in a 10-year or 5-year window, they're not entitled to Social Security benefits during that extra time or afterwards. So they may be hit with some sort of overpayment or something else that could be problematic for that person going forward. Now, just because you've gone through a trial work period doesn't mean that all of a sudden you can no longer get this ever again. You can ask to get your Social Security disability benefits reinstated if you stop working after that trial work period. And then you just get what you were entitled to, barring any sort of proof of medical improvement or continuing disability review. All right, I'd like to stop here and go over questions about the 2 Social Security programs that we've already discussed.
Okay, our first question, sorry, is the list, I'm sorry, many of our clients may not have physical addresses, and we may not know if they are eligible for Social Security benefits. What are the steps we need to take to help our clients receive Social Security benefits? Do we call Social Security to initiate the process?
Yes. So question is how to help some of your folks who may not have physical addresses start the process. So yes, so people can call the Social Security offices. You should call the local, and if they have a zip code or some other place where they can get mail, that is important, because that's going to help with the correspondence and with determining which office will handle their case. So you can call the Social Security office. You can also go online to help your clients and do some of that paperwork online, including designating someone as a representative for paperwork purposes. Not the same as a representative payee, which some folks may need, but this is someone who the beneficiary designates for Social Security to accept them as someone who can check on the status of their account or submit paperwork. But that's where I would start. A lot of the information that you would need to look at to see, okay, what other information can I gather? Where else can I submit it? They're available online at the Social Security website. You might, if that person has an email address, help them set up a Social Security account to see how much they might be eligible for, because there are calculators that are available online through their Social Security accounts, I don't know if it's mysocialsecurity.gov. I know Medicare has something similar, but that is something where they can access that stuff if they have access to the intranet. But I think the key is having access to some sort of mailing address, and then also that they can designate assistance through the process by filling out the appropriate form.
Okay, and the second question is, SSI has its own evaluators and doctors. So who decides the severity of the disability, and what happens if they disagree with the individual's doctor's assessment?
Yeah, so there are consultative evaluations that Social Security has hired these doctors to do these reviews. And so they will do essentially like a physical or something like that, a review, and they will submit what their examination is, good or bad. So with this process, if the beneficiary or if the applicant has their own records and has their own doctor who's willing to write a letter or send records, that's going to be helpful to the applicant, because that person should in theory, if it's a regular doctor that they've met with and had a relationship with, be able to offer more information about the person's potential disability, versus this person who comes in and is paid by Social Security and only sees that person once. And then if someone is denied based on that consultative exam, this is like any other public benefits program. There are constitutional due process rights where you can challenge the sufficiency of that expert, whether it is on matters of their ability to, whether it's about their physical health or mental health disability, or whether it's about their ability to work. So if you can produce additional evidence, you can challenge that. There are a number of both paper and in front of a judge type appeals that people do, and people often have to appeal in order to get onto SSDI or SSI because of those medical determinations. It's not impossible. I've helped someone. I had a client who had full-blown AIDS, and I could see sitting with him for just 20 minutes how exhausting a conversation was. And so we gathered a lot of his medical records. We went and challenged. I just did the first paper appeal with him, gathered information, wrote something to say he meets this listing, because HIV has a specific listing when it comes to disability. I think it's become much more strict because of a lot of the HIV medications that are available. And we won on that paper appeal without having to go to a judge, because we provided enough supporting documentation to counteract any sort of consultative exam that he had to go through Social Security.
Okay, thank you.
All right. Any other questions?
That's it for now. All
righty. Feel free to ask them throughout. If I don't have an answer for you, I can definitely follow up, just like we discussed at the beginning. All right. So here's a poll question. All right. And this is about your work. So have you helped someone apply for SSI before? So I kind of want to see who's in the room and what people do when they're working with these beneficiaries or potential. It would be nice if I had the Jeopardy theme song playing for these polls, but maybe next time. Okay, give it a couple more seconds. So most people have not, but a handful of you have helped in at least part of the way through an SSI application. So for those folks, your experience is very key to the next part where we talk about this. And if you have questions based on your experience, again, short of including any PII or PHI, feel free to ask questions in the chat. All right. So moving on, to SSI, which is for a lot of folks, their safety net. And certainly for a lot of the folks that we deal with, this is the benefit that a lot of people have. So this is again, a welfare program, a safety net program. It is needs-based. So it's a monthly benefit for low-income disabled and elderly folks. So in California has chosen to supplement the federal SSI amount, which is, the federal amount is like 700 something, and California adds to that. So the most someone can get for SSI is $943.72. And that is based on a couple of different things. So there are other factors and variables that I'm not expecting you all to know, and I certainly don't know them all, but things like your living situation, if you're blind, if you have other other folks that you live with, or have access to a kitchen or something like that, those all sort of determine, for most folks, it's going to be $943.72, which is below 100% of the federal poverty level. And in California, anyone who is eligible for SSI, be it for age or disability, they are automatically linked to Medi-Cal. So they will automatically get some sort of health insurance. Again, just like the other Social Security programs we talked about, there is a basic threshold where you are either age eligible or disability eligible. So your disability requirements are the same as the SSDI 5-step process that we went through when we talked about SSDI. Now, again, because this is needs-based, and for those of you who are also working with Medi-Cal, the rules are pretty much the same. Medi-Cal borrows SSI rules in that you're looking at countable assets, so a resource limit of no more than $2,000 for an individual, with some exceptions, and it's the same exceptions that Medi-Cal uses, like personal property, certain personal property, a personal vehicle, your house if you own it, certain life insurance policies or burial expenses. Those are exempt assets. There are also similar income rules because Medi-Cal uses those rules as well, where it talks about which income is countable, is it earned or unearned, there are all these different deductions. Just know that there is an income limit when it comes to SSI benefits, because again, safety net, needs-based program. Now, a person could be eligible for both SSDI and SSI. Let's say someone is disabled, but based on their work history means that they would only get $700 a month in SSDI or in retirement benefits, normal Social Security retirement benefits. So because they're below the SSI maximum, they could get an SSI award up to to bring them up to $943.72. So they can get both SSDI and SSI and thus have linkages to both Medicare and Medi-Cal. And if you see someone who gets a Social Security benefit, whether it is old age retirement or Social Security disability, and it's below this $900-something amount, they should be encouraged to apply for SSI because they've already got some sort of linkage to Social Security. So they should be able to at least supplement their income up to that maximum threshold. All right. And just like any other program, there's always the risk of losing SSI. So someone who has SSI can have their benefit restricted, limited, or suspended in certain circumstances. First being if they become hospitalized or institutionalized in any way. So in the hospital or in a nursing home or something like that, they can get a small needs allowance, but it all depends on how long they stay. And now something that we also deal with a lot at Legal Services is when someone is getting out of jail of some sort. So if someone gets incarcerated, they're not supposed to be getting any of these Social Security benefits. So their SSI will be suspended after 1 month. So basically, they're no longer going to get it. If they have dependents that are getting that income, those dependents will continue to get it. But after 1 year of incarceration, their SSI is terminated. So the distinction is if you're suspended, once you get out, you can ask to be reinstated without having to fill out more paperwork. But when someone is terminated, they're going to have to go through this process again. In theory, a lot of these reentry programs are supposed to help with benefits, but some places do it better than others. And I quite honestly don't necessarily trust that the resources are there to invest in having these, that there's investment on the institution's part in helping people reenter. If I'm wrong, I'll be pleasantly surprised, and I hope to be pleasantly surprised because there aren't a lot of pleasant surprises nowadays. And with Social Security, with SSI, there are similar termination conditions, so you're also still looking at whether or not you're disabled. So if there's any medical improvements, then, or if they, on a continuing disability review, they find improvement, then the SSI benefit will be terminated. Also, if someone is no longer income or asset eligible, similar to Medi-Cal. So like with Medi-Cal, if you start making too much money or you get some new property, and assuming you're not in any of the programs that don't have an asset limit, then you lose your eligibility for SSI, just like you would for non-Magi Medi-Cal. So that exists, that condition still exists as far as eligibility for SSI. So because these are all administered through the Social Security Administration, there are problems on both of these programs for folks, especially folks with disabilities. There are notorious lag times in processing for initial benefits. It can take a long time, and that's why I flagged with SSDI that someone could then be instantly eligible for Medicare because they waited more than 25 months for their benefits to process. There's also the problem of medical improvement. Whose standards are we using when we say this person is no longer disabled? And so a lot of this is paper review. Sometimes there might be a consultative exam, and that's why having as many of the medical and social records as possible when any of these reviews happen is what's going to help your client the most. And then one of the more painful processes, especially given that a lot of our disabled clients are relying on this money, that's the only money that they get, is being hit with an overpayment, which is Social Security believes they paid you too much because of X, Y, or Z. And because you got too much, we're going to get all that money back. And depending on how much of an overpayment, that could mean termination from the program and being asked to pay back a whole lot of money that, you know, for folks who only get a certain amount, they can't pay that back. So there are two methods to challenge these overpayments that we use frequently. One is the appeals process. So we just disagree. We think that the overpayment is incorrect. We think that actually they're entitled to the amount that they're supposed to get. We actually think they are owed monies, so that there's an underpayment to offset this overpayment. And if there's something about if they say, oh no, you improved, so you should have been cut off last year, proving that that person is still disabled, you can file an appeal. But the key is read all the paperwork, and that's where our clients run into problems. So not everyone keeps letters. Not all the letters arrive, and sometimes when they say they sent a letter, they actually didn't. So there are time limits that are involved when it comes to filing an appeal, and that happens at any stage of due process. You need to file an appeal in a timely manner, unless there is good cause. And good cause can mean this person was in the hospital the entire time, this person didn't have a proper mailing address, Social Security sent things to the wrong address. There are all sorts of things that can be used as good cause, and that can be used successfully as good cause in case the person couldn't appeal in a timely manner. And that includes things like mental health conditions. If the person can't manage their paperwork and couldn't find help until like a year later, that's an extreme example, but that is an example of something that might work to say good cause. Because if that person was disabled based on something like that and can't work based on something like that, then yes, there's a really legitimate reason why they wouldn't have been able to get a piece of paper in by deadline. There's also the waiver. If the person is not at fault for causing the overpayment, say it's someone misentered something and it wasn't the beneficiary's fault, and collection would defeat the purpose of this, then you can request a waiver of the overpayment. And that can be done at any time. Now, and sometimes we use both, but I think one of the things that you need to consider if you're looking at these options for someone who comes to you with an overpayment is that the appeal does not acknowledge that an overpayment was made. A waiver does acknowledge that an overpayment was made. So there's a bit of does doing one prevent you from doing the other? The answer is no, but think about your timing, because the waiver you can request at any time. So it's not that there's no deadline like there is for an appeal. So obviously you'll want to appeal if you can, if there's a reason to, in a timely manner. Otherwise, then you can go ahead and then you would file a waiver to say, sure, there's this overpayment, but I don't think you should collect it because it wasn't my fault. And those are federal programs. I want to flag a local program because every county has an obligation under Welfare and Institutions Code Section 17,000 to ensure the welfare of their residents. And one of the ways that case law has developed around that particular statute is in the form of income. So Sacramento County, like many other counties, has a general assistance program. It is completely funded by the county, and it is meant for single adults and couples without children or childless adults. The problem with this is it's not like a stipend. It's not necessarily a benefit. It's a loan. It is something that someone would have to pay back ordinarily. So to apply for this is like any other Sacramento County program. You go through the Department of Human Assistance to apply for this program. You can apply for it online. Sacramento, I think, is a My Benefits Calwin County. I'm trying to remember if it is. You can go there to apply for this program. You should be able to, because I don't know how many of the phone reps do this well. So there are some general requirements. You have a residency requirement. So that means you've been physically present in Sacramento County for at least a 15-day period before applying with the intent to reside. So that's sort of a flexible requirement, but it is saying you're here in Sacramento for a while. There is a requirement to repay the county for this when you have the ability to repay. So that's an agreement to reimburse the county, and also a request that you apply for other programs that you might be eligible for, like SSI, like SSDI, like retirement, or like early retirement. And if your SSI benefits are approved, the county will will have a lien on a certain amount of it. And then there's a deprivation requirement, which means you're either unemployed, you're employed for less than 100 hours a month, or you are incapacitated and unavailable to work due to your disability. And then there's an asset requirement. So this is much more strict than Medi-Cal or SSI. You can't have more than $10 cash in hand, and there are some property limits and exemptions. So I would refer you to the fact sheet on GA for that. So Sacramento County issues these benefits through EBT, through vouchers, or in kind. And it's up to $326.64 for folks who are non-exempt. And for those who receive disability benefits, it's a little bit more. Not sure how that works because, again, there are some other financial requirements, but they do have some exemptions regarding disability benefits. And any other income received during the month is deducted from the grant amount. So again, that's the maximum you would get. This is a time-limited program, so it's not like SSI where you just do a continuing disability or make sure that you're continue to be eligible. You can only get GA for 3 months in any 12-month period. But if you are unable to work, you're considered unemployable, that time limit does not apply to you. All right. So I wanted to walk through an example of someone that you might, based on some of the feedback that I got initially, someone that you might encounter. And then what you might do with these programs to help, what you could do with your understanding of these basic income support programs to help the person that you're taking. So Marty comes in, enrolled in Medi-Cal, and he may have a disability, would benefit from a regular source of income. So what's available for Marty, and how can you help? So because he may have a disability and he's enrolled in Medi-Cal, that should tell you a couple of things, that you might want to look at the disability-based programs and get started on that. So I think one of the questions earlier was about how do I help someone get started? So the same advice is applicable here, is you can work with the beneficiary to start the application process by calling the Social Security office or going online, helping the person locate any medical records, because that'll save some time in processing the application, understanding the general assistance program. So that might provide some temporary assistance for him while he is going through the application process to get him just some sort of assistance to go forward, just like any other public benefits program. And then there are a couple other programs out there. Prop 63 has funded various community partners to provide the Sacramento Multiple Advocate Resource Team. Right now, it's a program at El Hogar. But this program has been working with folks who have mental health, specifically issues, who are at risk of homelessness, to apply for the SSI program, and has a history of having a really good record. I want to flag another program, the Housing and Disability Assistance Program, which I'm not as familiar with because I learned about this 2 weeks ago. But it's a program that's designed, it is funded through the California Department of Social Services, which doesn't normally do housing programs, but has a lot of housing programs in its portfolio. And this is a program to help disabled individuals who are experiencing homelessness with applying for disability benefits and some housing assistance. So these programs are required to do outreach, case management, disability advocacy, and housing assistance. Sacramento County is one of the 30 plus counties that actually participates. And if you go to the link in the link that I provided, they have the contact information of the folks at the county who are responsible for implementing this program. I don't know much about who is doing the advocacy or who is doing what, but it is something that, if it works, is promising for a lot of the people that we want to serve. So, okay, so now let's take another break for questions.
And we have a few, actually. The first one is, are rental rates in a given geographic area taken into account when considering SSI dollar limits?
No. And that's why California supplements, but rental rates aren't real. I mean, it's not about how much you pay each month for that. I mean, if it is, then we'd have a very different public benefit system. But no, a lot of this stuff is determined nationally. There might be some regional variations, but that's based on things like states supplementing things, or states having additional requirements or additional exemptions. But yeah, it'd be nice if that was something that we could include when we're advocating for our beneficiaries around the resource limits, or around what they could get from the SSI program.
Okay, the next one is, because my clients need to know how much income they're having to prove they can afford housing, how much time does it take to get approved for SSDI or SSI?
It can take years. And that's the unfortunate thing. I think one of the benefits, if you can look at silver linings for this COVID era that we're in, is that with folks from Social Security working at home, things are actually getting processed a little quicker. But I think with the disability reviews, those are still rather lengthy waits. And I know for a lot of our folks, that means that they can't provide that information as soon as they need it. So that's why, like, if you help someone apply online, you can track that application. And at least you'd be able to get a sense of where it is. But no, it can take a while for some of these benefits to be approved. And that includes the appeals process.
Okay. Is there accommodation or special consideration for people with diagnosed behavioral health challenges?
So accommodation in what sense? I think, for instance, if the person is unable to fill out forms, then there are certain ways to handle that. If a person has known behavioral things that affects their ability to have a regular, consistent relationship with a treating provider, that's something that notes and like social worker notes or other social agencies can provide supplemental advocacy on. Certainly, if I got a case like that and I was doing an SSI appeal, that's who I would reach out to if I couldn't find any records that it could explain why this person wasn't having some sort of regular care, both mental health wise or physical health wise. But as far as, I mean, there's always some sort, because this is a federal program, things like the Americans with Disabilities Act apply, any sort of civil rights legislation that involves a person's disabilities, whether perceived or actual, would apply, and reasonable accommodation could apply. It just depends on how well you can document things. So yeah, most of the folks that I've worked with through SSI appeals, there's usually been some sort of documentation that I could get or supply that would help support certain weaknesses that implicate their ability to do certain things. Because again, part of that disability determination is whether they can work in any job in the national economy. And if some of their issues prevent them from doing so, then this is supporting application that if I can get it, then I'm going to use that to support the determination. I'm not sure that actually answered your question though.
So this is a question that it kind of gets to the next layer of that previous question. Can you speak specifically about people who are longtime drug addicts or especially alcoholics and are not now able to function enough to work because their mental capacity is diminished? Is there a way to advocate for these people who seem to fall through the cracks? So I guess, is that a disability?
All right. Can you repeat that question? Sorry, I got pinged on something.
Can you speak about persons who may be longtime drug addicts or especially alcoholics and are not able to function enough to work because their mental capacity is diminished?
So with that is where you try to equal a listing. So depending on what their functional limitations are, you'd want to take a look at how you could argue that some of the long-term effects of their, because the issue, and this is one of those biases that a lot of the administrative law judges may have, is that you did this to yourself. But just because someone had issues with addiction or all that stuff doesn't mean that if they cleaned up now and tried to work, they wouldn't be suffering from things that prevent them from working. So you argue about some of the things that you can provide evidence for. It is a longer road. It is harder because of the inherent and the both implicit and explicit biases regarding behavioral, like the effects of the long-term effects of some of the things that may be attributed to people's so-called choices. But there are ways to try to equal a listing. So for instance, some of the addictive behaviors may fall under some of the mental health listings, or some of the physical fallout from the long-term effects, like certain organ failure, for instance, may also meet or equal listings. And also the ability, like if their vocational profile is such that they wouldn't be able to work anywhere with their job set, with their skill set, then that's also something that I would work on arguing and supplementing into the record.
Okay, and then the last question for this portion. What are some of the exclusions for general assistance funding?
As far as
I don't know.
What kind of income wouldn't they count as an exemption, that kind of thing?
I don't know, I'm sorry.
Okay. So the information that I have available is also on that fact sheet. That's where they go through some of the rules. There's also a GA manual that is available. It's floating around online. I can take a look at that and provide more information to follow up. I assume it's a little bit more strict than Medi-Cal as far as income exemptions or resource exemptions, because this is where you have nothing, or that's sort of where they interpret safety net to be under Welfare and Institutions Code 17,000. But it is sort of restrictive in sort of what it is. So things like in-kind donations, all that stuff, those things count against the person. If you're sharing meals, that can count against the person applying for general assistance. But I know that a lot of the information is available on a GA manual that is available online. And if it's not, what I'll do is I'll take a look and try to forward the information to the organizers to make sure that you get that information.
Also, if there is a list of the conditions, medical, mental health, behavioral health conditions that the folks on the phone could get, and that might be the document you were referring to. That way they would know in advance of referring people to the various programs that you mentioned.
So the list of disabilities, for instance.
Right.
Okay. Yeah, that is publicly available as well. Yeah, basically it's a listing of impairments, and it goes through all the different systems. So that is available on the Social Security website. If you look for listing of impairments, they list them based on whether the applicant is a child or adult. And so most of our folks are adult listings, which is part A of the listings. And it goes through all the different systems for what type of disorder. So like, for instance, the listings under category 12, that's where all the mental health disorders are, and you can click through them to find out what medical criteria is necessary to say that someone meets the listing.
That was it for the questions right now.
All righty. So I'm just paying attention to time. So poll question. All right. So Medicare used to pay for 100% of a person's medical costs, but it no longer does. True or false? All righty. So I'm going to go ahead and end the poll now. So it's a mix of folks. So right now, Medicare does not pay 100% of a person's costs. And honestly, I don't think it ever has. But I'm only familiar with the program as far as I've needed to use it. And so for as long as I've known about it, there's always been a cost. I don't know if it started out free or not, but as far as I know, I always talk about Medicare costs, and that is what we'll be talking about right now. All right, so I work at HICAP. I do Medicare counseling all the time. What is Medicare, and how do I explain it to folks? So Medicare is the federal health insurance program. So it is a federal safety net program, or not necessarily safety net, but I consider it safety net. It's primarily for folks over the age of 65 and for folks under 65 who have disabilities. It's a creature of the Social Security rules, so you'll see Social Security stuff peppered into this. Eligibility is not based on financial needs. So you basically have to meet sort of a certain threshold, but it's not based on your finances. And Medicare is not a free program. So a lot of us who work, we pay payroll taxes into Medicare. If you ever popped out your paycheck stub and looked at all the deductions, you'd see Social Security, you'd see FICA, you'd see all these different things. One of them would be Medicare. And that is those quarters that we talked about for Social Security are also related. That's sort of the same animal. And so with Medicare, there's a lot of costs to a beneficiary. They come through premiums, they come through deductibles, they come through copays. And so it adds up very quickly. But for a lot of our low-income beneficiaries, there is help that's available to help them manage those costs. And as healthcare gets more and more complicated, and as health insurance gets more and more complicated, there are folks that have needs for additional coverage to deal with those costs, or because they have access to other things. So for instance, you might have a retiree plan from your work. You might be eligible for Medi-Cal. You might buy a health plan, an HMO through Medicare, or a private plan or a supplement. You might be eligible because of your military background. There are other benefits that might be available and thus might cause problems for someone trying to access Medicare. So who runs Medicare? So I take a lot of this alphabet soup for granted, so I apologize for that in advance. But this is where a lot of that alphabet soup comes from, the fact that this is a creature of alphabet soup. So you've got CMS, or the Centers for Medicare and Medicaid Services. They're a part of DHHS, the Department of Health and Human Services, and they administer Medicare. They're the ones who contract with a number of companies to handle how Medicare works, whether it's how medical services are delivered, whether it's how appeals are delivered, how their bills get paid, how they monitor quality of care and complaints. They're the big kahuna as far as Medicare is concerned. Now, the Social Security Administration is the one that deals with signing people up for Part A and Part B. Not for a health plan, just for Part A and Part B. So they're the ones that deal with premiums. They're the ones that deal with cards. They're the ones that deal with turning you into pushing the button and turning on your Medicare benefits. Now, I work a lot with the Office of Medicare Hearings and Appeals, and that's where I go to challenge a Medicare decision at a certain point. So just like with Social Security, where you can challenge a denial or an overpayment, you could challenge a denial or other thing with Medicare denials. And then there are tons of Medicare administrative contractors, or MACs. They are the folks that are contracting with Medicare to run certain parts of Medicare, like the appeals process, like claims determinations, that kind of thing. So again, thick on alphabet soup. So Medicare has 4 parts, more alphabet soup. So there's Part A, which is when you think of hospitalization, you think of nursing home or skilled nursing facilities, not necessarily nursing home. That's Part A. Part B is what we think of traditionally as health insurance. We go to our doctors, we go to our specialists, we get durable medical equipment. That's all covered under Part B. Part C is actually the Medicare Advantage program. It's if you want your programs through a health plan. So that usually provides prescription drug coverage as well, but they cover everything that A and B covered and sometimes more. And then Part D is the prescription drug plans. You have to purchase a private plan in order to get your prescription drugs, which is one of the frequent issues we have with a Medi-Cal beneficiary who ages into Medicare. Now, all these have costs, whether they're premiums or copays, and there are programs that help with certain costs. So there are Medicare savings programs. That's the Qualified Medicare Beneficiary, or QIMBY, Specified Low Income Medicare Beneficiary, or SLIMB, Qualified Individual Program, or QI. And those help with premiums and some copays and deductibles. There's the low income subsidy or extra help. That helps with some of the out-of-pocket costs related to prescription drugs. And then Medi-Cal on top of that provides some additional benefits to help supplement what Medicare covers and what Medicare costs. So what is covered? We're looking at a universe of medically necessary healthcare services. Medicare puts out a scope of defined benefits that it gets updated every now and again through legislation and through decisions, administrative decisions, for services that are reasonable and necessary in the diagnosis or treatment of an illness or injury, which sounds very similar to Medi-Cal standards of what they will cover, although Medi-Cal covers more things. There is specific coverage criteria for different types of care and services. So for instance, they recently released some guidance on how acupuncture gets covered by Medicare, and that basically it's limited to lower back pain, to chronic lower back pain, but it's better than before where there was no coverage of acupuncture. And then things keep getting added to the Medicare program, such as when the Affordable Care Act passed, a lot of preventive services such that the ACA requires of all of the health plans are covered through Part B as with no copays and aren't subject to the deductible. But it's just a testament to the fact that this is an animal that is constantly changing. So Medicare isn't comprehensive. It doesn't cover many types of needed care. For instance, someone who's looking for vision or routine dental, it's not going to be covered through Medicare. Neither will someone who needs long-term care, like nursing home services, or in-home, like custodial care. That's not covered by Medicare. So some basics about enrollment. Social Security is where people go to enroll in Part A and Part B. And if someone is already receiving Social Security benefits, when they become eligible for Medicare, they will automatically be enrolled in Parts A and B if they're eligible for both. If someone turns 65 and has not yet gotten signed up for Social Security, they will need to go to Social Security to sign up for Medicare. They can start signing up 3 months before their qualifying event. So for Part A, the hospital insurance, it is for those who have paid into the system 40 or more quarters. They don't have a monthly premium. But if they have fewer quarters, they're going to have to pay to sign up for Part A voluntarily. So for those folks, they need to be 65 or older. They need to live in the US. They need to be a citizen or have to have a green card for at least 5 years in order to sign up for Part A with a premium. And then Part B, there is a premium for this. This is the medical insurance portion of it. There's a monthly premium. It's based on income. And if you don't sign up for Part B right away, depending on how long it took you to sign up, you may have a late enrollment penalty that increases your monthly premium. So when does someone sign up for Medicare? There are a couple different times that a person can sign up for them. There's the initial enrollment period, which is a 7-month window that covers that month of that trigger. So if someone turns 65 in July, they can start signing up 3 months in advance. So that would be what, April? Or they can sign up to 3 months after July. So that is October. And during that time period, they can make any and all decisions. They can change their mind as long as what happens at the end of that, and what happens at the end of that 7-month window is what they're stuck with that year. If they've missed their initial enrollment period, they have a general enrollment period from January to March. and the benefits would start in July. And for someone who deferred Part B because they were working and had other coverage, they have an 8-month window after they lose that other coverage to sign up for Part B. And that's if they didn't sign up during their 7-month initial enrollment window. Now, Part D is not a requirement. Part D is voluntary. But if you work with Medi-Cal beneficiaries, you know that they have to sign up for a Part D plan in order to continue to get their prescription drugs. You can sign up for Part D if you've signed up for either Part A or Part B. You do not have to have both. And that's a problem that we've seen where they just thought they had to have both. So they didn't sign up for Part D. Now, there is a late enrollment penalty. If you have a gap in coverage of more than 63 days, then you're going to have a late enrollment penalty. And you can show that if you had some other coverage, let's say the person has VA coverage, that's considered creditable, and they won't have a penalty. Now, there's the same timelines for signing up for Part D. You can sign up during that 7th-month initial enrollment period. You can sign up every year during open enrollment, which runs from October 15th to December 7th. And then you have a number of different special enrollment periods if you experience some sort of triggering event. Now, you have to sign up for a private drug plan for this. And each plan has very different benefit structures. So some plans are less expensive than others. Some plans will cover certain medications better. Some plans will include different pharmacies. So it's important that people sort of take a look at what their options are when they're signing up. All right. Any questions? I realize that we're running low on time and I didn't anticipate that. That is my problem.
Yes, we have one right now. In the past, I have had clients denied SSI disability due to the client not having 6 months without drugs or alcohol use, even though they have a qualifying disability. Is there a way to appeal that decision?
Yes, you can appeal those denials all the time. I think then what you would do to support that stuff is to talk about whether that is even relevant, and 2, put more emphasis on the underlying disability, especially their ability to work. Because remember, these are programs for folks who are not going to be able to participate in the job market because of their underlying disability. That's what I would argue, and by the time it reaches that stage, you'd hope that 6-month window or whatever they're arguing is done. But I think there are ways to argue based on things like mental health or based on addiction or based on other underlying conditions where that is just not relevant, where you can make that irrelevant.
Okay. How do I know if someone already has Medicare?
So they should have access to a Medicare card, which is the red, white, and blue card. The other thing to do is to call with the person to 1-800-Medicare, and that person can give information. The customer service rep can look up the person's account as long as the person is with you, and get the information, including if they don't know their card information, get the card information. Get any prescription drug information. That's often something that I encounter where someone doesn't know that they have a prescription drug plan, and get that information through 1-800-Medicare, which operates 24/7.
Okay. How do I get someone enrolled into a Medicare savings program, and how much in benefits do they get if I do that?
So depending on what they need, so Medi-Cal is actually the agency that does the Medicare Savings Program's applications. So you'd go to the same place you go to apply for Medi-Cal. You can ask that they specifically be screened for Medicare Savings Program. For instance, if they don't want Medi-Cal, or if they are not eligible for Medi-Cal but might be eligible for these Medicare Savings Programs. Now, depending on their income and assets, there are different levels. So it's all based on their income level, but they would get things like the Part B premium. If they have to pay a premium for Part A, they could qualify for the Part A premium. It would protect them from balance billing. So Medi-Cal would be secondary and pay what Medicare doesn't pay. And there are the additional benefits that come from, and that's sort of what Medicare Savings Program would, okay, again, depends on which Medicare Savings Program. For the most part, the most useful thing for that is the Part B premium gets paid, so they don't get that deduction from their SSI or Social Security. And they get help with their prescription drugs because they are automatically linked to extra help. Now, if they got in a different program, in the program designed for much lower income folks, then they get other protections. And then there's also Medi-Cal. If they're Medi-Cal eligible, they'll get the Medi-Cal protections.
Okay. What is extra help for Part D, and how do I get it from my client?
Extra help is basically assists with paying premiums, copays, and deductibles. So these are all private health plans. They all have premiums associated with it. And depending on the structure of the program, there might be an out-of-pocket cost that is associated with before the plan starts paying for it. So for someone who's on insulin, they're going to be out a lot of money before the plan actually picks up any cost. Extra help basically makes a person eligible for certain benchmark plans where the premium is less than the subsidy. So they wouldn't have a monthly premium. They also wouldn't be subject to the deductible, and the copays would be lower. So anywhere from $1.35 to $8.50 would be their copay. Now, for someone who's on Medi-Cal, that is a lot of money because they previously didn't have any copays at all. But it is, compared to being on that private plan, a lot more affordable and a lot more reasonable. And to apply, Social Security has a website for extra help, and that's how you do the application for the low-income subsidy.
Okay, got a few more questions.
Mm-hmm.
What if my client does not have any work history that I can tell? What are the things they should enroll into?
So if they turn 65, then they could get SSI for income support if they don't qualify for any sort of work history-based Social Security retirement program. They could still qualify for Medicare, and depending on their work history, they may have a Part A premium. If they don't have any income at all, they could qualify for the QIMBY program, the Qualified Medicare Beneficiary Program, and Medicare Savings Program, which would help offset those costs. And then Medi-Cal would also be a potential depending on that. They can always consult with Social Security to get an idea of what their work history is, and that would give you a sense of which of these benefits would actually work best for that client.
Okay, and what can prevent a disabled person with Medicare from obtaining Medi-Cal?
Assets. So if they income and assets. So again, you're looking at the traditional Medi-Cal rules, because this person who, if they are getting Medicare, is not eligible for Magi-based Medi-Cal. So then the asset test applies. And also up until August, unless the legislature screws up this compromise, the income threshold is below 138% of the federal poverty level. It's actually about 122%. So income and assets would be a reason why someone who is on SSDI and on Medicare wouldn't qualify for Medi-Cal. But they could qualify for a Medicare savings program.
That was the last question.
Great. So I know that we're out of time, but I don't know if we want to just go through the Medi-Cal portion of it because of the dual eligible stuff. What do you think?
I think we're gonna keep going.
All right. So for those of you who are hanging around, and I know this will be recorded, so it'll be available. So how about Medi-Cal then, and how does it interact with the folks who are disabled and who are older and who are eligible for Medicare? So hopefully you know some of these things, but as a basic primer, Medi-Cal is the federal-state partnership providing healthcare to low-income beneficiaries. It is run under the Department of Healthcare Services and administered by the county. So in Sacramento, the Department of Human Assistance is the one who runs eligibility. So for the most part, for Medi-Cal, you need to be low income and under resources to qualify. But Medi-Cal is an umbrella term for several different programs with different income and asset tests and linked, some of which you have to have a specific disease status. Others you have to be linked by a program like CalWORKS or SSI, and others are just low income or age disabled. And most folks on Medi-Cal receive their services through managed care organizations. So again, Medi-Cal eligibility is very complex. Unless you are a Medi-Cal assister, I really don't expect you to know that there are all these different rules, other than that rules exist. So the big ones that we know that people should know about is expansion Medi-Cal or Magi Medi-Cal, which was California's option under the Affordable Care Act, and started providing Medi-Cal to childless adults under 65 who didn't have disabilities, starting in 2014. So it's a relatively new program. And it is income-based. There is no asset test. So we're looking at an income limit of 138% of the federal poverty level. That becomes a problem when someone becomes eligible for Medicare, because with Medicare, there's a cliff, and that is that the asset limits start applying, and there's a lower income cap. Now, in August, assuming everything is compromised to the benefit of our beneficiaries, the income cap will be the Magi limit. But again, that assumes everything is going to go all right. And with our federal government being the way it is, we can't count on anything. So how does Medi-Cal help a Medicare beneficiary? So for beneficiaries have full, no share of cost Medi-Cal. And that's usually the SSI folks, those who have federal poverty level, and those who are in the working disabled program. The state's going to pay in and buy Part B. So it's like you have a Medicare savings program. There's a lag, but the state will, once they know this is a Medicare beneficiary with full scope Medi-Cal, pay that Part B premium. And that person also qualifies for extra help. And extra help comes with a lot of enrollment benefits, like you can change your plans more often than someone who doesn't have extra help. The issue comes with, and I've said this a couple times, with Part D and prescription drug coverage. Medi-Cal doesn't pay for prescription drugs once someone becomes eligible for Medicare, because you're supposed to exhaust all available resources. Medicare Part D is one of those resources. And so Medi-Cal, as the payer of last resort, will not pay if there's someone else who should. Medi-Cal will send out a scary looking letter for folks who don't know what's coming. It's called a reduction of benefits notice. And it'll just basically say you need to sign up for Part D. Now, there are some drugs that Medicare will cover, or that Medi-Cal will cover, that Medicare doesn't. Usually those are folks that have to deal with weight loss, weight gain, or anorexia. There's some over-the-counter drugs that when prescribed by a physician will be covered by Medi-Cal that aren't covered by Part D. And then there are certain prescription vitamins and minerals that can be covered under Medi-Cal that Part D doesn't cover. So want to talk through some scenarios about what you might do to help someone when you're screening someone. Grace is 64. She's been living in a shelter for the past 6 months after relocating from Modesto. She's going to be turning 65 in 2 months. She's currently enrolled in Medi-Cal. She might have a disability. She could use a source of income. What should Grace know, and how do you help her? So we look at Grace's age. We look at what she's currently got. She is homeless or at risk of homelessness. She might have a disability. She's turning 65. So the key is that she's on Medi-Cal. So she's got some health coverage, but she's going to be turning 65, which means she'll be eligible for Medicare. So Medicare would be one thing. With Medicare, you'd want to look at whether or not she'd need a Medicare savings program, especially if she doesn't get free Part A. And so she's going to have to ask the county to apply for the Medicare savings programs. Her income supplement is also something that could be useful. If she doesn't go for early retirement, because she is 64, so she could, if she has work history, get early retirement from Social Security. But she's also approaching being old age. So she could get Social Security, but she could also qualify for SSI. which makes her disability irrelevant because she'd be over 65. And if she doesn't have an income, she could qualify for up to that $900 and something maximum for SSI benefits. If she has a disability, at this point, it wouldn't matter. SSDI would not be useful for her because she turned 65 before the application gets processed. Now, looking at another person, Keith, 67 years old, lives on the riverbank, has been disconnected from all benefit systems for at least 5 years and has no employment history, documented home income, and is experiencing homelessness. So he's recently discharged from the hospital after being treated for an infected wound. What's available to assist Keith? So because he's 67, he might have, if he has no employment history, he's not going to be eligible for retirement, even though he's at full retirement age, but he could be eligible for SSI. And then he could also get assistance with applying for that and with getting housing through that housing and disability advocacy program through the county, just so that he could get onto somebody to get housing assistance. SSI will be a little bit easier because since he's 67, he's not going to need to prove disability. He just needs to say he is 67 and he doesn't have income. He just applied through Social Security now. Now, he should also be eligible for Medi-Cal if he has no income and he's over 65. And if he has no income, he should be eligible for full scope Medi-Cal, which should also help him with Medicare. Since he doesn't have income or he doesn't have documented income or employment history, he would have to pay Part A and Part B premiums. But he would qualify for a specific Medicare savings program that would help him pay for both. And it doesn't matter that he didn't sign up when he was first eligible, because if you have a late enrollment penalty and then Medi-Cal steps in to pay your Part B premiums, Medi-Cal is only going to pay the base premium and the rest of it gets waived. So if, for instance, he no longer qualifies for Medi-Cal, his Part B premium is going to be the base premium. It's not going to include the 2 years he could have been enrolled in Part B. So those are sort of the income and health programs that they are eligible for, that he's eligible for, that'll be sort of maximize what he could get from the system as it is currently. So I know we've gone way over. I'm sure there are plenty of questions. I'm willing to take any questions and then do some of the follow-up resources.
No questions right now.
Great. So it all makes sense. All right. So I do want to flag Senior Legal Hotline. For those of you who work with folks who are 60 or older and may have other legal issues, there is a free hotline that's funded through the Area Agency on Aging that'll help with any sort of, almost any civil legal matter. So things like estate planning, evictions, grandparents' rights issues, trying to find retirement benefits, Social Security matters. There are attorneys and staff that are able and available to help folks over the phone, not in person currently. As long as they're over the age of 60, it doesn't matter what their income is. They just need to be Sacramento County residents. Again, unless they're seeking pension or retirement benefit issues, that can be, we can serve anyone at any age who have questions about their pension or retirement benefits, unless they're asking about veterans benefits or Social Security, because that is a different thing for that grant. And that is a much more geographically expansive program as well. So I wanted to leave you with how you can get help from legal services, especially during our physical office closure due to the coronavirus. We are operating by phone. All of us have access to our phones through our computers and working from home. So you can call any of these numbers to get the relevant assistance. So our main office to deal with public benefits, housing, health, some civil rights and education issues, that's 916-551-2150. Now for HICAP, we have our main line, which is 916-376-8915. That is our scheduling phone number. So for folks in Sacramento County, we'll get that call or message and then schedule them for a counselor who works with Sacramento County beneficiaries. And then for senior legal hotline, the phone number is 916-551-2140. We're all on the web as well, so you can Google us and find more information and some resources available, especially to help folks who are dealing with COVID-related issues. So for instance, folks who may be facing evictions due to the fact that they couldn't afford their rent because they lost their job during the shutdown. There are a lot of resources available there that can help beneficiaries who may or may not need SSI, SSDI.
John, one of the questions is, what if we need casework help? And I guess it might depend on what the casework issue is.
Yes, so depending on what the issue is, if you have authorization from your client to talk to an advocate on their behalf, that's what we would need to talk to an individual. We also have a couple of different referral mechanisms. So depending on what kind of work what kind of issue it is, I would contact with the relevant number. If you have questions, I'm fine with you contacting me. I realize that I didn't put my individual contact information, but I think we can forward my information and make that available through your resources. So if you have questions about who to contact or how to handle certain things, then I can help with a relevant warm handoff.
Great. Does HICAP offer other trainings online? I guess this could be recorded or live.
That's what we are working for. So we've been doing a lot of things in person, or we had been doing most of our trainings in person. But obviously that's not a modality that we can use currently. Our outreach and education coordinator has been working on scheduling things online for folks. So depending on how often people need things or if they can gather something, we're willing to do stuff. And we are looking to either recording or putting together a regular schedule of Zoom or Hangout meetings, whichever thing we feel is going to work best, so that our outreach coordinator can continue to do the Medicare 101s that she used to do every other week.
Okay, and then in closing, I want to let people know in the chat box, there is a link to our evaluation survey. Please fill that out. Also, if you have any questions that weren't answered today or do not receive our email with the link to the recording, which should be out in a day or two, our email address, please send us an email at pathways@transformhc.com. And I'd like to thank John for being a great speaker and such a great participation. We still have many people still on the call, which is great. And we hope you'll join us for our next learning community. Thank you guys very much.